Everyone, this is going to be a first question in in a very long list of questions. And these questions are going to be very different than AMBOSS, UWorld, and NVMe. I mean, of course, they will be sharing the same concepts and similar information, which is related to step one, step two, ZK, step three, but they would be different and would hopefully help you prepare for the exams. So let's start with this first question, which is primarily related to microbiology, specifically viruses. Okay. So the way that I approach questions is that I always read the last sentence or the last question first, and then I go back and read from the beginning. So which of the following drugs is the most appropriate treatment? Okay, so that's a concept question, very basic, just asking about a specific drug. The 38-year-old man who is HIV positive comes to the clinic because of a 5-month history of recurrent painful mouth ulcers. So automatically, this should give you at least a hint of a diagnosis. Most HIV positive patients, at least in the realm of step one, have uh, eh, complementary diseases. For example, a patient could have pulmonary TB, herpes zoster or shingles, Kaposi sarcoma, which is HHV8, uh, could also have pneumocystis pneumonia, could also have cryptosporidium, histoplasmosis, toxoplasmosis, cryptococcal meningitis, could also have Mycobacterium avium complex or CNS lymphoma. So these are all possibilities a patient could have who is HIV positive and has a lower CD4 count. Of course, every CD4 count corresponds uh, to a higher likelihood of a certain disease. For example, if a patient has less than 100 CD4 count, then more likely to have toxoplasmosis than, for example, MAC, which is Mycobacterium avium complex. Um, well, this question is not really talking about Mycobacterium or toxoplasmosis. So let's move on. This question is primarily going to talk about HSV. Uh, he says the pain is so severe that he cannot eat. He has a history of epileptic seizures and is currently taking levetiracetam or Keppra 1500 milligrams twice a day, or BID. Physical examination reveals vesicular ulcerations. So vesicular ulcerations is very pathognomonic or a buzzword for HSV, herpes simplex virus. It's a DNA virus, and physical examination reveals vesicular ulcerations on the lips and sloughing of the gums, buccal mucosa, and hard palate. Genetic analysis of the pathogen from the lesion reveals a mutation encoding viral phosphorotransferases. Okay, interesting. Which of the following drugs is the most appropriate treatment? Okay, so let's solve this question from bottom to top. Foscarnet. So foscarnet is effective against the HSV virus, and uh, and also would not require phosphorylation by viral kinase to function, which would seem that is the correct answer. So, uh, just going back a little bit and seeing the second line, which says genetic analyses of the pathogen from the lesion reveals a mutation encoding viral phosphotransferases. So most antiviral agents, almost all of them over here except prednisone, which is a glucocorticoid, a steroid. Uh, Most antiviral agents that require phosphorylation to function, example nucleoside analogs, which most of them are, will not be effective in treating this pathogen because this pathogen has acquired a mutation in the gene encoding viral phosphotransferases. An example of a viral phosphotransferase would be viral thymidine kinase. So coming back to option choice G, uh, of course, this foscarnet is very effective against the HSV and does not require phosphorylation. However, this agent should not be used in patients with seizure disorders or epilepsy because it can cause electrolyte abnormalities. That's just a side effect that you guys would need to remember. It's like a very minute detail uh, to remember. Um, okay, so we'll cross that one out. Uh, next one is cidofovir. Cidofovir is also is well, cidofovir is a viral DNA polymerase inhibitor um, that is effective against HSV, but it doesn't require phosphorylation by viral kinase to function. And seizure disorder or epilepsy is not among the drug's contraindications, and therefore we can use that treatment for this patient's infection. So let's hold on to F. Um, E, prednisone. You wouldn't be using prednisone. Prednisone is a, a steroid, and steroids most often are immunosuppressants. So if you suppress the immune system of this patient, you would most likely be causing prolongation of the disease or increasing the intensity of the disease. So cross off E. D, val acyclovir. You wouldn't be using val acyclovir or acyclovir. Both of them are, of course, good treatments for HSV infection. However, both of them require phosphorylation by the viral thymidine kinase to function. So therefore, they wouldn't be effective against this pathogen in this case because, I mean, this pathogen cannot really cannot really make a functional viral thymidine kinase. Next one is famciclovir. Again, similar, requires phosphorylation by viral kinase. So famciclovir. Uh, Next one is ganciclovir. The ganciclovir is primarily used to treat CMV infections, cytomegalovirus infections. CMV is so CMV is HHV5, EBV is HHV4, and ganciclovir is not really used to treat HSV infections. It also requires phosphorylation by viral kinase to function. So the CMV, if a patient has a CMV infection, the CMV would use the would use the viral kinase phosphorylation to activate ganciclovir. I think I already talked about acyclovir. So acyclovir, even though it's like a first line treatment for HSV infections, it requires phosphorylation by viral kinase to function. But in this case, again, the viral kinase is non-functional because of the mutation, and therefore would not be effective against this pathogen. Okay, I hope this helps you guys, and this helped elucidate the differences between the different antiviral drugs that can be used for HSV infections uh, and the mechanism of action as well, specifically the use of phosphorylation by viral thymidine kinase.